Medications play an essential role in our health. However, we often overlook their potential adverse effects on the heart. Some seemingly harmless medications can have serious consequences and even jeopardize cardiovascular health without us being aware. 1. Minoxidil. Known for stimulating hair growth, minoxidil can affect heart rate, increasing beats by up to 20 per minute. Additionally, it can cause fluid retention and, in rare cases, lead to serious conditions such as pericardial effusion. Minoxidil, a topical medication used to treat hair loss, works by dilating blood vessels in the scalp, thus stimulating hair growth. However, this same vasodilation action can also affect other tissues in the body, including the cardiovascular system. When minoxidil is absorbed into the bloodstream, it can cause vasodilation throughout the body, resulting in decreased peripheral vascular resistance. This can lead to a drop in blood pressure in some cases, especially at higher doses or when combined with other medications that also affect blood pressure. Additionally, minoxidil can directly influence cardiac function by affecting the contractility of the cardiac muscle and electrical conduction in the heart. This can result in changes in heart rate, leading to tachycardia or palpitations in some patients. Another common side effect of minoxidil is fluid retention, which can lead to the development of edema, especially in the lower limbs. This accumulation of fluids can increase the volume of circulating blood and put additional strain on the heart, especially in patients with heart failure or kidney disease. Although severe cases of cardiac side effects related to the use of minoxidil are rare, it is essential to closely monitor patients using this medication, especially those with a history of heart problems. It is important for doctors to be aware of these potential side effects and discuss the risks and benefits of treatment with the patient before prescribing minoxidil. 2. Antifungals. Medications such as fluconazole and itraconazole, often prescribed for fungal infections, can prolong the QT interval on the electrocardiogram, increasing the risk of severe ventricular arrhythmias, especially in patients with heart failure. Antifungals, such as fluconazole and itraconazole, are commonly used in the treatment of fungal infections, such as candidiasis and mycosis. However, it is important to be aware that these medications can have adverse effects on the heart. One of the main risks associated with the use of these antifungals is the prolongation of the QT interval on the electrocardiogram. The QT interval is a measure on the electrocardiogram that represents the time required for ventricular depolarization and repolarization. Prolongation of this interval can predispose the patient to serious cardiac arrhythmias, especially ventricular arrhythmias, such as torsades de pointes. This can occur due to the effect of antifungals on the cardiac conduction system. Patients with heart failure are particularly vulnerable to the adverse effects of antifungals on the QT interval. The presence of heart failure already indicates dysfunction of the cardiac muscle, and prolongation of the QT interval can further increase the risk of potentially fatal arrhythmias. In addition to the risk of arrhythmias, prolongation of the QT interval can also lead to the development of other cardiovascular complications, such as ventricular fibrillation, which is a severe form of cardiac arrhythmia that can lead to cardiac arrest and sudden death. Therefore, when prescribing antifungals, doctors should carefully evaluate the patient's medical history, especially regarding pre-existing heart conditions. In some cases, it may be necessary to regularly monitor the electrocardiogram during treatment to detect any changes in the QT interval early and take measures to prevent serious cardiovascular complications. 3. Glaucoma. Eye drops. Eye drops containing substances such as timolol can reduce heart rate and blood pressure, leading to fainting, especially in people with pre-existing heart problems. Glaucoma eye drops are an essential part of the treatment to reduce intraocular pressure and prevent damage to the optic nerve. However, it is important to be aware of the potential side effects of these eye drops, especially on the cardiovascular system. Timolol is a common substance found in glaucoma eye drops, and its primary mechanism of action is to reduce the production of aqueous humor, thereby helping to lower intraocular pressure. However, timolol can also have effects on the heart and blood circulation. One of the main cardiovascular side effects of timolol is the reduction of heart rate and blood pressure. This occurs because timolol can affect beta-adrenergic receptors in the heart and blood vessels, resulting in a decrease in sympathetic activity. In patients with pre-existing heart problems, such as heart failure or cardiac rhythm disorders, the reduction in heart rate and blood pressure caused by timolol may be even more pronounced. This can increase the risk of fainting and other cardiovascular complications. Additionally, prolonged use of glaucoma eye drops containing timolol can lead to significant systemic absorption of the substance, further increasing the risk of cardiovascular side effects. Therefore, it is important for patients to inform their doctors of any pre-existing heart conditions before starting treatment with glaucoma eye drops containing timolol. Doctors should closely monitor patients using glaucoma eye drops, especially those with a history of heart problems, and be alert to signs of cardiovascular complications such as fainting, dizziness, palpitations, and weakness. In some cases, it may be necessary to adjust the dose or discontinue the use of the eye drops to prevent serious cardiovascular complications. 4. Cold remedies. Some cold remedies contain substances such as pseudoephedrine and phenylephrine, which can raise blood pressure and heart rate, causing discomfort in patients with hypertension or arrhythmias. 5. Antidepressants. Certain antidepressants, such as amitriptyline, venlafaxine, and citalopram, can increase the risk of cardiac arrhythmias and elevate blood pressure, requiring caution in patients with a history of heart problems. 6. Antibiotics. Some classes of antibiotics, such as macrolides and fluoroquinolones, can prolong the QT interval and increase the risk of severe cardiac arrhythmias, as well as cause damage to the heart valves in rare cases. 7. Erectile dysfunction medications. Although generally safe, medications such as Viagra and Cialis can trigger serious cardiac complications, especially when combined with nitrates. Data in patients with pre-existing heart problems such as heart failure or cardiac rhythm disorders, the reduction in heart rate and blood pressure caused by timolol may be even more pronounced. This can increase the risk of fainting and other cardiovascular complications. 9. Diabetes medications. Some diabetes medications can cause fluid retention, worsening heart failure in predisposed patients, while others may reduce cardiovascular risk. 10. Anti-inflammatory drugs. Widely used for pain relief, anti-inflammatory drugs such as ibuprofen and diclofenac can raise blood pressure, increase the risk of thrombosis, and interfere with the effect of blood pressure medications, being especially dangerous for patients with a history of heart problems. Doctors should closely monitor patients using glaucoma eye drops, especially those with a history of heart problems, and be alert to signs of cardiovascular complications, such as fainting, dizziness, palpitations, and weakness. In some cases, it may be necessary to adjust the dose or discontinue the use of the eye drops to prevent serious cardiovascular complications.